Hi there, I'm Dr. Chung and welcome to your friendly proctologist. This is a space to discuss your bottom end health, and I really hope you can relate or learn a thing or two. Today I want to talk to you about something really traumatic. And well, I do talk to you about a lot of traumatic things, but this one is especially traumatic. I can guarantee you that. Some people describe it to me as like someone is stabbing them with a knife or even a sword. Other people say my poop feels like there's rocks on the outside of it. And the most common story that I get is I feel like I'm pooping shards of glass. Oof. If you have not experienced something like that, thank your lucky stars, right? Because the people that are going through this are having one heck of a time. Now, some people are fortunate that they have this maybe for a few days and then it goes away. And other people, it can last for a week, it can last months, and other people, it lasts for more than a year. What am I talking about? I'm talking about anal fissures. And what is an anal fissure? The basic principle, if you were to break down the word, is anal, in your butt, and fissure, a break in the skin or the lining of your anus. And the fissure, which it implies, is a wound, right? Because the skin is nice and continuous, but once you split the skin outside lining, you have a cut there. And so it's kind of like a canyon, right? You have one edge of skin here. They used to be connected, but now that you've got a separation, now you've got a canyon. You've got the two edges of skin which used to be touching, and now you've got something in between here. It's the cut. And why then is it so painful? I mean, I get a cut in my arm and it doesn't hurt that bad. I'll even get it, on my face, and it doesn't even hurt that bad. Well, there are many nerves in your anus, and they are closely packed together. Plus, the type of nerve that they are extremely sensitive. And so when you get an injury, the signal gets sent to your brain, and this signal is loud, really powerful. The brain then sends that and combines it with your emotions, and it is very tough to make that signal a happy one, because I will guarantee you that the distress call that's coming from your anus is only going to be perceived as a negative one. And that's why once you get that pain, you're shocked, you are terrified, and it ruins your whole day. Sometimes the pain, it doesn't last for like 1 millisecond. We're talking about hours after the bowel movement as well. And so definitely there are reasons for why it feels the way it does. Also, we can talk about how it makes you feel, right? The pain is one thing, but you think that you might have cancer, you might be dying. A lot of people see blood on the tissue paper or in the toilet because, again, you get that rip, and when you get any tear in your body, blood usually follows. And so all these things are running through your head, and it just, you get the idea, right? So what's the deal with the fissures that heal? And why is it different than from people that have these fissures for up to a year? Well, the answer lies in the anus muscles, or the anal sphincter. And the anal sphincter muscles, right, that's what opens and closes at the very outside of our butt. It has two parts. There's an internal, inside, and there's also an external, outside. And they're circular, right? The outside muscle is the one that you have control over. So when you feel like you squeeze your butthole, that's the outside one. The internal one does not have that conscious control. And so you may feel like you're relaxing, but I'll tell you, when I examine people, there is no relaxation here at all. Some people have really good, or they're very in touch with their body, and so they actually do have some control of their internal muscles, but that takes some training. So it's not completely conscious, but definitely it's something that is the core of the anal fissure. So what do I mean? Okay. If we were to take away this external muscle, the internal muscle is what we want to talk about because it actually contributes the most amount of force in that contraction, okay? And when you squeeze on that muscle, it also squeezes on the anal fissure, which is in the inside here. And let me turn my hand around this way, it makes it a little bit easier to see. When the muscle is squeezing really, really tightly, it actually will squeeze out all the blood which is within its grasp, right? And you can see my hand is getting white here. And that means that there isn't very much blood getting to the wound on the inside. And what does a wound need to heal? Well, it needs its nutrients, it needs its food. So that means the blood brings it oxygen, the blood brings it the cells and the proteins and all the building blocks to make a wound and then cover that skin. And if you cut off the blood supply, that wound is going to have a really, really tough time healing it, right? And so that's why the muscle needs to be calmed down in order for it to open up and then allow more blood flow to get in. And we'll talk about treatment in a future video, but that's what the treatment centers around, including fixing a lot of the habits and going into that in order to optimize things. But I like to, or my previous mentors and the doctors that have trained me have termed people with an anal fissure, or the strength of the muscle, as those who have the strength of Superman's anus or Superwoman's anus. Incredible Hulk, because it takes a lot of strength, and that death grip that it's got, which is making on that anal fissure, is what's causing the problem and cutting off, just strangling off that blood supply. The other thing I'd like to say is anal fissures are extremely hidden. You'd think that you'd be able to see it on the outside, you know, just take a mirror to it. Well, I'll tell you that rarely can you see anal fissures from the outside. And that's why I believe that going to someone like me with a surgical specialty like colon and rectal surgery or proctologist are better able to diagnose something like this, because when you're in the examining table in my office, people don't want to relax their bottom ends, but that's what you have to battle against and coach people to relax in order to see these wounds, because they are inside, they are lined up with the internal anal muscle, which is further inside of the anus, about a ½ centimeter or so. And so based on that anatomy, which I have full extensive knowledge about because I do surgery all the time, these are the kind of things that some clinicians don't know, and that they are missed and mistreated all the time. I hope you learned something today about anal fissures, and what I wanted to do today is really state what the problem was, how to describe that problem, and to help you to better recognize whether you might be fitting into this camp. More videos about anal fissures are definitely coming, and I hope you stay with me through that journey. If you enjoyed today's content, definitely let me know. Like, subscribe, and leave a comment, please. I definitely made this video in response to a comment, and so I definitely read and I try to respond to as many comments as I possibly can, because I appreciate you sharing your story. Thank you once again, and I'll see you next time. Bye-bye.